and welcome to Disaster Zone, a show about emergencies and disasters that can happen at any time. And my guest today is Glen Mays, Professor and Chair, Department of Health Systems, Management and Policy in Colorado's School of Public Health. Glen, great to actually see you because we've only been talking to one another, not seeing one another again.
Fantastic. Great to see you again, Eric, and glad to be with you.
Okay, and our connection is via the National Health Security Preparedness Index, and that's something that you've managed for a number of years, and we're going to briefly talk about here today and look forward to the fact that there's a new updated version of that index that's just been released, and we're going to zero in on Washington State a little bit later in our discussion here. This index looks at all 50 states and Washington, D.C., but again, we're going to look more specifically at Washington State in particular. So Glen, why don't we start out and explain what makes up the National Health Security Preparedness Index? It's kind of a mouthful there, and the process you use to achieve ratings of the various states.
Sure. Well, it's a great question. And so the National Health Security Preparedness Index is a tool for measuring the strength of the nation's emergency preparedness and health security system overall at a national level, and also down for individual states and even down to individual counties now. So it's a way of measuring how strong, how well prepared are our healthcare and public health systems to respond to hazardous and emergency events of all types, anything that could threaten health status for large groups of people, including, weather events, storms, fires, and floods, including infectious disease outbreaks like this COVID-19 pandemic that we've been undergoing. So it measures these kinds of protections, how strong they are for any type of hazard that could threaten health status for large groups of people.
Did you have any more difficulty in getting those statistics this year because everybody was so busy, or it was more of a routine information gathering?
Yeah, no, it has been a little more difficult. And so the index, we construct the index by pulling from many different data sources. A total of 130 individual measures go into the index from more than 60 different data sources. And some of those data sources are, collected by doing surveys of public health laboratories or hospitals or nursing homes. And some of those data collection efforts over this last year were definitely delayed because of the pandemic, because so many of our organizations that play a role in health security were actually actively responding to the pandemic.
Okay, so let's talk more specifically about the pandemic. I mean, you had your ratings before the pandemic began because you've been doing this for a number of years. And then we had this, we would call it a stress test of the public health systems, the medical systems here in the United States. What general observations might you have, and were there any surprises to you, because you're very familiar with this type of information?
Yeah, well, interesting this year, looking at the national trends, this last year was the first year where we did not see an incremental improvement in the overall level of health security and preparedness. And we attribute that directly to the pandemic. Over the last 8 years, we've seen every year some incremental levels of improvement in health security and preparedness. For 2020, this last year, the overall level was flat. And we attribute that to our public health and healthcare systems being in active response mode. And so not having the resources and time and attention to devote to planning and improvement for future emergency events, because we were actively in the response mode to the current event. So that was one notable difference this year, is the overall preparedness level across the country was flat over this last year. It's good we didn't see a decrement, but we also did not see an improvement as we have seen over the past 7 years.
Any surprises in a single category or that type of thing?
Well, we did actually see some improvements, continued improvements in a couple of different domains of preparedness. In particular, in the incident management domain, which has to do with practices and protocols that we use in responding to the acute phases of an emergency. We did see improvements in that area, even though that's already the highest level of performance of any of the 6 domains that we measure in the index. And obviously that incident management, coordination and communication functions have been very important in, getting us through the pandemic. So that was a bit of a surprise that we did see improvements there. We also saw improvements in the environmental and occupational health domain of the index, and a domain that has been lagging behind some of the other functional areas that we measure in the index. Saw some improvements there. Nationally, did not see much improvement in the healthcare delivery domain. And we know that's a domain that really was stressed in many parts of the country in terms of thinking about hospital capacity, emergency department capacity, staffing, healthcare worker staffing, and dealing with shortages, and also with personal protective equipment. So that's an area that we know we struggle with in the pandemic, and it shows in the index as well.
And when we think about disasters, a flood event might take a week or two to resolve. An earthquake is over in a matter of seconds or maybe even a minute. But then you have a long recovery, but the response phase is not that long. Here we had the health system responding from, I would say, February of 2020 all the way through to today. It started with the whole testing phase, then responding to the number of people who were being infected and deaths. And this year, it's been all about the vaccination process. So when I talk to healthcare professionals, the thing that keeps coming up is they're very fatigued and there's a reason they got better at responding, because they were responding for so long, I think.
Absolutely. I mean, that has been one of the unique aspects of this particular emergency is the duration. And you're exactly right. Part of that duration allows learning by doing. We've gotten better in domains, especially, as I mentioned, that incident management domain. But we're also seeing fatigue and turnover in many of components of the workforce that are essential, both in healthcare and in public health. A lot of attention being paid to the levels of stress that state and local public health professionals have been under, partly because of the political dynamics around this response. And we've seen lots of turnover, both in healthcare and in public health, and that does limit our ability to maintain responses, and it limits the ability to surge as we need when there are upticks in these kind of hazards.
Yeah, and there were a number of state and local public health directors that resigned during the pandemic, and I know hopefully we're over the big hump here, but the Seattle King County Public Health Director has recently announced her retirement. She's not resigning, but retiring, but it's been a long haul. Talking about Washington State, this broadcast goes out to people in King County, Washington, and they're likely interested, well, how did my child do, if you're in school? It's great to hear what the school numbers are, but what about my kids? So how did Washington State fare? Were there areas where, I won't call them accolades, where it did better, and areas maybe where there was some struggle to it?
Yeah, absolutely. Washington, like every other state and every other jurisdiction, has both strengths as well as vulnerabilities in its preparedness and health security activities. Washington, over time, over the last 8 years since we've been conducting this index, Washington has kind of bounced between being lagging a little bit behind the national average in overall health security levels, and then being right in there, right within the national average. And over this last year, we did see Washington make some gains and move back into the national average level, overall level of health security. from after a couple of years of being somewhat below average. And so that is notable, again, particularly during this pandemic response, that Washington was actually able to make some incremental improvements. For Washington, it was particularly in the surveillance domain as well as in the incident management domain. Washington made some significant improvements there over the last year, and that brought Washington back into the national average level with regard to overall health security. It also made some significant improvements in environmental and occupational health. Washington did in that particular domain.
Explain surveillance. This isn't cameras, but some people might not be familiar with health surveillance. What's that mean?
Yeah, great question. It's the ability to rapidly detect and diagnose health threats in the population. Threats that could be, like in the pandemic, of an infectious disease nature, where we've got to test for that, figure out who's got that disease, who's been exposed. Laboratory testing capabilities loom large in this domain. Other kinds of data collection and data exchange capabilities between public health and healthcare, health surveys, testing in water, in air, in food, in soil, all those things come into that surveillance domain.
And, I just read, I think it was the Washington Post today, city of Seattle was in the news as the most vaccinated city in the United States. San Francisco kind of had that for a while, but I think we're now up over 70% vaccinated for the population. I think it's 12 and up was the number. So kudos to all the healthcare professionals that work to do that in cooperation with the many different support agencies there.
Absolutely. That's another very important component of health security, and one that lots of parts of the country are struggling with now in rolling out the vaccine. You're absolutely right. Washington is in that group of leading edge states in getting vaccines for COVID rolled out, which is fantastic.
Now, I'd like you to give a message to my immediate neighbor, who's a wonderful person and helps me a lot by watering my pots when I happen to travel, but says, no, I'm not going to get vaccinated. Why should everyone get the COVID, vaccination?
It's the strongest protection that we have against the health risks associated with COVID infection, and it's remarkably effective compared to the other vaccines that we use in our public health toolbox. And so, even though it's a new technology, and we have only limited longitudinal experience, we still are trying to learn about how long vaccination protection lasts, for example. We know that it is very safe and incredibly effective. And this is the pathway out of the pandemic. And it's something that's not just an individual protection, but it protects society when we get vaccinated. So it really is it's a civic duty at this stage. Just as if we were drafting people to go to war against a military threat, vaccination is the equivalent of our call to duty for the American population.
Yeah, that's interesting you say that, because sometimes I talk to citizens about voting, and I say the citizens' responsibility is to, one, pay taxes, if called to defend their country, to serve, and then the other is to vote, because we have that right that many people have died to defend and protect. And I guess I'll add the next one you just said is to be vaccinated to protect yourself and the people around you. So that's a great message, Glenn. Any last thoughts to share with our audience?
Obviously, we've learned a lot about health disparities and inequities in health through the course of the pandemic. And it's important to recognize that those same inequities exist and play out when we talk about health security protections of the kinds of things that are measured in the index. The fact that we do see wide geographic variation in health security protections around the country is also an ethical and moral issue, and there's a lot of work we need to do to close those disparities so that we have equal protection, so that all American residents can benefit from the protections that we have against hazardous events.
And none of this happens just because somebody had a great idea. Why don't you just mention where the financial sponsorship for this study has been coming from and is being supported from?
Absolutely. So the index was initially created with support from the CDC, our federal public health agency, and the CDC is still very much engaged. But the Robert Wood Johnson Foundation, the nation's largest philanthropic organization devoted to health and healthcare, has been supporting the index over the last 5 years and continues to support this work. And we're definitely very, very thankful for that.
Okay, and I have to mention there is a Seattle-King County connection there that Dr. Alonzo Plow, who once was the public health director for Seattle-King County, is the responsible party that administers this program on behalf of the Robert Wood Foundation. So it's great to see it kind of come full circle for Washington State and King County.
Absolutely. Alonzo is a wonderful leader to have.
Okay. Well, thank you, Glenn, for being on the show. We've had Glen Mays here talking about our public health readiness. So many times it's hard to measure, and by having this program, we actually, through all the various pieces that they try and survey to figure out where we are, we have a scale to measure against, and we just are thankful to you, Glenn, for running the program and coming to be here on the Disaster Zone program today.
Great to be with you. Thank you so much, Eric.
And for everybody at home, now is a good time to think about disaster preparedness and what you can do to be ready. And as we talked about today, get vaccinated. Thanks for watching, and tune in again soon for another Disaster Zone program. Bye-bye.